Hello, everyone. I'm Filipa Rodrigues. I'm a certified prosthetist and orthotist, and I will be talking about maintaining stability and managing joint pain. So I will start with telling a bit about me. I'm a Portuguese Certified Prosthetist and orthotist, or CPO, and besides that, I'm also an athlete that I run for Portugal in orienteering. I study in Lisbon. It was a 4 years long bachelor degree in prosthetics and orthotists. From the moment that I finished my studies, I started working in Stockholm. Previously, I did my internship the last year in the clinic or in several clinics here in Stockholm. And then I got the job in the one that treats mostly kids and adolescents. So I work since 2018 there. I'm experienced with orthotics in various diagnoses like clubfoot, pectus carinatum, cerebral palsy, EDS, among many others. I'm very competent in the production process of special made orthotics, especially for clubfoot. I'm a member in the ADS National Specialty Network, and I'm a children's orthotic specialist in my company here in Sweden. So we can start about talking about hypermobility. I work mostly with children and youth, but I also take many of the patients, adults that have hypermobility problems. The thing about the children and the youth, they usually have already an increased range of motion. So the hypermobility that we can find is often not considered a symptom by the doctors here. Usually it's associated with other health complaints, and it's hard to recognize and classify as a joint hypermobility syndrome. So kids have quite a long process until they get some kind of diagnosis that goes in the joint hypermobility syndrome spectrum. And usually it needs to help with this process. Other family members may be affected, so that usually helps. Signs and symptoms of the hypermobility syndromes: knee and ankle and foot pain, falling, gait and coordination problems, joint swelling, clicking joints, recurrent injuries, joint luxations, neck or back pain, pes planovalgus, knee hyperextension, cardiovascular dysautonomia, mainly postural tachycardia syndrome, or POTS, as is it known, functional gastrointestinal manifestations, sleep disturbance, fatigue, depression, and anxiety. The treatment in the EDS and the ASD, usually in the studies, they say that adapt physiotherapy, assisted devices, pain medication, physiological counseling, among others. Many studies also say that the proprioception is very important to prevent undesirable positioning, such as hyperextension and hyperreflection, and plays a protective role in lesions. Another study tested the hypothesis that the elastic bandages improve the proprioception of the joints involved during its use, and this benefit was more than temporary. My important role as a CPO, I meet the patients and I help prescribing and applying the orthotics that they may need. I usually ask several questions like when and where the body does the patient feel pain, what activity gets affected by the pain, what goals does the patient have, does they want to train more, do they want to be able to sit without pain or to stand and do their job, what does the patient to study or work with? Is it full-time, half-time? Can they have a full day of work, or the pain incapacitates them? Has the patient tried any orthotics before? And how is the patient's sleeping routines? Our clinical assessment, we check the range of motion, which are the joints that's hypermobile. We do a gait analysis. We check the position of the ankle, the knees, the hip, in stance and swing phases. We check when they're standing upright, the position of the joints. And then we also check the balance and strength. We usually ask for them if they can go up in their toes, and if they can do that with the eyes closed, and if they can stand in one leg and also with the eyes closed. Our treatment approach, we can use both prefabricated and specially made orthotics. There's a full range of orthotics for the whole body, insoles, ankle foot supports, prefabricated orthosis, SMOs, supramellar orthotics, AFOs, ankle foot orthotics that are specially made, knee orthotics, hip orthotics, back and shoulder orthotics, hand and wrist orthotics, and finger splints as well. Now I will start to show you some of the main orthoses that I usually use on my patients. This is quite a good guide to what can you fix, what can you get to help you with managing your pain and help stabilizing. Starting with the foot, we have the insoles. I usually always start with insoles on my patients. And they can be prefabricated or custom made by scanning or casting. Then we have the prefabricated ankle supports, like the ones from Bauerfeind, the one from Morliman and Osur. The two first ones are mostly compressive, and they stabilize with the help of the extra bands that go in at 8. And then you can regulate how much tension you want on them. These ones usually are quite good to use with shoes. They don't take much space, and they can also be used at home without shoes. So they are quite practical, especially with the younger patients that maybe have gymnastics at school and they maybe go without any shoes. So it still helps to give some support. The last one from Osur is a bit more clumsy, but still it can fit in some shoes as long as they are not too tight. It has a bit of more plastic on the sides, so it has extra stabilization. So for patients that need more stabilization than just the compression in the bands, these ones usually are really good. Continuing the foot or the ankle, we also have the AFOs and SMOs that can be specially made. Most of the patients don't use the specially made AFOs because they are quite big or they take too much space. And many of the patients, especially a bit youngsters and young adults, they have a combination of knee orthotics with ankle foot orthotics, so it can be a bit clumsy to have a big AFO. SMOs I already used sometimes in extreme cases when the prefabricated ones don't work. Then we can also have AFOs for night use. So there can be also a model that the patient can wear during the day, but usually it's easier to have something a bit more simple, like the one that you can see there. Quite easy to control, so it avoids the extreme plantar flexion because some patients have problems at night. and they wake up with the pain in their feet. So this usually helps. So it maintains the angle, so it avoids the extreme positions. Going to the knee, we have also several types of orthotics. We have the ones that are only compress, like the one from Osur there in blue. That one is the simplest one. Then we have the first one on the left, has a bit more stabilization, especially for the patella. But is also mostly the compression, so it doesn't stabilize as much as the jointed one. The second one from Janova usually has a really good acceptance in young adults, and because it's not too clumsy, but still has a bit of a side joint that it's not too big and still helps to stabilize a bit more. Then we have also jointed ones that work for a little bit smaller patients. That's the one, the last one on the right. So that one controls both the patella and it helps with the plastic joints on the sides that are a bit stronger than the one that I talked before. All of these ones you can always adjust with the extra straps to, for example, avoid the hyperextension if your patient has a lot of that and you cannot control it with just the orthotics per se, then you can adjust it and do a little cross on the back. For extreme hyperextension, there are some orthotics that have a joint that you can exactly adjust how much they can extend or flex the knee joint. This one is a model that I use a lot in adults, and it also has a X on the back to also stop the hyperextension. But in addition, you can also change with a bit stronger joints that can stop the hyperextension or the extension quite a lot. For the hip, usually we tested a lot here the pregnancy support bands. They can be used quite under the clothes, and they are quite discreet, and many patients think that they are really comfortable, even they can sit with it, and it gets the whole of the trochanter, stabilize the hip joint. So this one's the orthotic was not made for this specifically, but the patients usually really like this fix. Then you also have the specially made trousers from Element's Body. It's orthotics from Camp, and it's compressive trousers, and you can adjust where you want extra compression. So these ones are really good, but unfortunately they are not prescribable in all the parts in Sweden, and they are quite expensive to buy. So there's many patients that maybe don't use them. But as an alternative, there's also the MediPosture Plus. Those ones also are compressive. They don't have this adapted compression, but they're still, they have an extra band around the trochanter, and they help stabilizing the hips. So I usually also recommend these ones because they're a bit cheaper and more accessible to the patients. Finger splints, you have the finger bands that you can complement with other orthotics. Sometimes they can also be used during the night. The finger splints or rings in silver, these ones are quite popular, especially in adults, because they help with the hyperextension of the finger joints. And there's also a version in plastic that we sometimes use here, especially with the smaller patients. There's a variety of sizes as well. Hand orthotics. We have the compression and elastic orthotics. There's all the simple ones. Just some of them, like the first one has a small plastic stabilization under that can be removable if it's too much, and it also has a band that goes around the wrist, so it helps in certain situations to stabilize a bit more. The second one is mostly the same as the first one, but it has the band on, so you can see how it looks like. We also have the compression gloves that are from camp, the body elements, and those ones are also made by measurement, and you can also adjust the compression where you want it to sit. But these ones, like the pants, are quite expensive. So we have found other alternatives, like the compression gloves that can be found online. So it's usually the patients have a really good result with these ones, and they are more accessible. Hand and thumb, we have with the stabilizing splints as well, and with and without thumb support. So there's a big variability of these ones. On the end, we also have this hand-led orthotics that helps stabilizing or control the extreme flexion of the hands, like you can see on the videos. And usually I adjust that little thumb. On the hand, we also have these specially made ones. We only take a measurement around the wrist. These ones are made in leather. It's a really good acceptance in adults. It's a reminder or a little stop of the hyperextension of the wrist, as you can see on the video. On the night for the hands, we have a quite simple resting splint from camp. We can also make specially made orthotics in felt or silicone. For the elbow, you have very good orthotics that limit the hyperextension of the elbow. And in some cases, I usually also test this epicondylate orthotics that by holding the radius and the cubitus together, it reduces the movement on the elbow. So there's many patients that think that they get extra stabilization, and it has helped them a lot. The first one that I talked about, it can also be used as a knee orthotics with hyperextension, knee orthotics with hyperextension stop in small patients. So it's a good idea if you don't find a knee orthotics that fit you. Shoulder and posture, you have the shoulder braces from Mediroyal. That one is really good with the adaptation of bands. You can also have a shoulder orthotics that holds the shoulders in the right position. And you also have the Medi Posture Force. That one, it's also really good. It can be used also under other t-shirts and clothings. And of course, the Camp Elements body is also a really good option by my measurements. On the back, you have several lengths of corsets and spine orthotics. They have flexible support splints, and you can choose which height you want to give stability. And there's also camp selection. The one on the right is also really good. It has an extra support on the back. From the neck, usually I don't use a lot of the neck orthotics, only extreme cases. You need to be careful positioning in the right angle, so it's not in overextension. And never use during the whole day, only when it's needed, for example, in the subway or train, buses. And driving, I don't recommend the hard ones because you cannot turn the head. So if someone needs, it should be a softer one and a lower one, so you can be able to turn your head while driving. The goal, it's always to stabilize, positioning, correcting, increase proprioception, and reduce the pain. And with this, we increase patients' independency and activity level. Thank you very much for listening.